Dr. Sajid here again, continuing our talk on vitamins. We're going to be talking about vitamin A today. So we'll mention what vitamin A is and why is it important, what are its sources, in other words, where do you get it from, and why does deficiency occur, what are the signs and symptoms, how do you recognize them, how common it is, and what is the treatment if there is deficiency. So let's begin by saying that vitamins, as has been stated before, are substances that are essential for growth of the human body and brain, but are only available from food generally. So they were named A, B, C, D, E, and K according to their discovery, and vitamin A therefore was the first vitamin discovered way back somewhere in 1920. Now it is important because the deficiency is common in children especially, and as many as 30% of the children under 5 years of age in some African countries and South Asian countries like ours, this is quite prevalent. It causes a number of problems, and therefore it is important to recognize it and to make sure that a child does not have vitamin A deficiency. What are the sources? It's very simple. There are two sources. One is what we call animal sources, such as the liver, kidneys, egg yolk, and butter. And the second is vegetable sources, which is green leafy vegetables and sweet potatoes and carrots. So these foods are available in a child's diet, and it is not a problem. So why does deficiency occur? Primarily because children may not take the kind of foods that I have just mentioned. They may take one form of food and not the other, and their food is not balanced and it is not complete, and therefore you can get deficiency. Sometimes the diet is adequate, but the child may have a medical condition whereby this is not being absorbed properly. But that happens very rarely. And the other situation is where a child gets frequent intestinal problems such as diarrhea or respiratory infections, and therefore the absorption of vitamin A, which occurs from the intestines, may be impaired, and the baby, despite having adequate intake from the diet, may develop a deficiency. So how do we recognize it? It has multiple effects. One of the most well-known effects of deficiency is blindness, and in some countries it is the commonest cause of blindness in children. The other is what we call night blindness, and that is poor night or darkness adaptation, which means the child cannot see very well at night, is all right during the daytime. Also causes rather dry skin, dry hair, dry eyes, may cause bone abnormalities, also affects the immunity of a child and a person, and is generally considered a very useful vitamin for growth and development. The treatment is very simple, and that is that there should be either an adequate diet, which includes, like I've said, animal sources and vegetables, and of course we have already said fruits and milk, and some of the milk in many countries, even in Pakistan, is fortified with vitamin A and D, and that is recommended. The other is, if there is deficiency, then you can be given doses of vitamin A, which can come in either capsules or in drops, and they can be given. Now, we had also mentioned in the talk on vitamins that you can, over overuse vitamin A. So do not use it unnecessarily. Just do it in the doses and the duration that your doctor has recommended, because if you take too much, it can cause toxicity, and that can have harmful effects for the child. So vitamin A, in brief, is an essential vitamin. It is very useful. Deficiency causes a number of problems, and it's very simple to treat it, but the best thing is to be able to prevent it. I hope this information has been of use to you.